So, good morning, everyone, and welcome to our Devon International Recruitment Hub webinar. This is week 5, believe it or not. So hopefully we've already seen some of you online with our other weekly webinar sessions that we've been running. And you'll see that we've had guest speakers come along and talk about their journey to the UK. Last week we had one of our OSCE trainers come and deliver some very basic introduction to OSCE teaching. And then we spent the latter part of the session answering questions that you have. So just a reminder, please put your questions into the chat box. I've got the lovely Jack on the call as well, who's one of our recruitment partners, and he'll be here to answer any of the recruitment questions you've got. So everything's getting exciting now. We've got our first arrivals in July and August. So I will be in touch with those people that have had their certificates of sponsorship issued in the next week or so. And part of my job is to introduce you to your clinical teams, and we will be delivering some more training and education for you before you get to the UK. So we'll just give it a couple minutes while we're waiting for our guest speakers to arrive. But please, you can start your questions and we will answer them. Okay, our attendee numbers are climbing nicely. So I don't know if we have Rima on the call yet, Jack. Okay. So we've got 2 guest speakers hopefully joining us this morning. We're just having a few Microsoft issues. We've got lovely Daya and Rima, who are nurses from India, and they're going to come and talk to you about nursing in the UK and how things might be different compared to nursing in India. Again, pop your questions in the chat box and we will have an opportunity a bit later to ask Daya and Rima those questions. Okay, so it might just be worth, what I could just use this time opportunity to do is I've got some OSCE training videos for you. So Jack, I just wondered if you might better share my PowerPoint and we could just do a little bit of OSCE training and use this opportunity to go through an introduction to OSCEs. So last week we had one of our OSCE trainers come from the Royal Devon and Exeter, which is one of our partners, and they talked about introduction to OSCE and also as an overseas nurse, how the process was for them to go through the OSCE examination. So it's a real personal account, and I hope you found that useful. So if I could have the next slide, please. So I just wanted to begin really and start introducing you to our governance processes in the UK. So as you already know, our governance structure is the Nursing and Midwifery Council, and we call that the NMC. So you will see that abbreviated a lot in your documentation and as you start to travel to the UK for your career. Now our code, so this is our fundamental documentation as to the expected standards for nurses in the UK, and it's a code, it's a written document that provides the expectation of standards of behaviour for nurses, midwives and nursing associates. We have to withhold these standards in order to stay on the register in the UK. Now there's 4 themes for the code. So the first theme is about prioritising people. The second one is practicing effectively. Third one is preserving safety and then also promoting professionalism and trust in everything that we do. Now, each section of the code contains a series of statements from nurses and midwives in the UK to give really good examples of what good practice looks like. So I would urge all of you to go on the Nursing and Midwifery Council and read the code, because everything that you do in your practice in the UK will be based on the code. That includes your OSCE exam, okay? So next slide, please. Now, the other thing you may already be aware of, but this is something that will also come up all the time and is fundamental in every aspect of care and professional standards that you deliver in the UK. And we call these the 6Cs. And this forms the basis of our nursing practice. So that's care, compassion, competence, communication, courage, and commitment. Again, they are woven into your OSCE exams, okay? So please start reading the NMC Code of Conduct, which is on the NMC website, and start to think about these 6Cs and the standards, okay? And next slide, please. Okay, so I've got a video here which is going to talk you through an introduction to OSCE. So hopefully this link will work and we can play it.
Welcome to this series of videos designed to support you in your preparation for the Nursing and Midwifery Council's Part 2 Test of Competence, the Objective Structured Clinical Examination, or OSCE.
This video series is not intended to offer a definitive guide to passing the NMC OSCE. Instead, it offers a series of snapshots of best practice to help you understand what to expect and how to perform in your role as a newly registered nurse. With all of these videos, you will have the opportunity to repeatedly practice these skills in the workplace, supported by experienced clinical staff.
Where we offer advice which is specific to the NMC OSCE, we will note this as an exam tip. The NMC OSCE framework provides the gold standard for nursing practice, working to the guidelines of the Royal Marsden Manual of Nursing Procedures and the European Resuscitation Council guidelines.
As you're probably aware, there are two parts to the NMC OSCE examination. The first section simulates a clinical environment. Candidates are presented with a typical patient scenario that newly registered nurses are likely to encounter in their role. The section is divided into 4 stations: assessment, planning, implementation, and evaluation, APIE. The first station involves a live patient played by an actor.
There is no definitive list of possible scenarios, and there is no guarantee of which one you will be presented with on the day. These videos will focus on general skills you'll need to exhibit regardless of the specific scenario, just as you would in your day-to-day clinical practice.
In the second section, candidates have to demonstrate safe and practical application of skills. Candidates complete 2 stations drawn from a wider pool. In these videos, we will walk through 2 examples of skills stations: aseptic non-touch technique and administration of medication by IM injections. We will also briefly look at basic life support, but not go into detail.
Again, there is no guarantee you'll have to perform these specific skills during the exam. Instead, we will focus on general principles which are applicable in your everyday practice.
The stations mirror clinical practice as closely as possible, but one key difference is that there is a time limit for each station, which you must be mindful of during the OSCE. Try to work through the scenarios at a steady pace to avoid rushing your actions towards the end.
Throughout these videos, we will reinforce the following key practice principles. The candidate's role is that of a nurse at the point of registration. Candidates must show regard for patient safety. Candidates must make the most of opportunities for the promotion of health, and candidates must meet standard of clinical quality.
One of the first things to note is that the role of nurses in the UK can be quite different from those overseas. There is a greater emphasis on patient participation and patient choice. In the next video, we'll start by offering some tips for making sure you're communicating effectively in your everyday practice.
That's great. Thank you, Jack. So you can see that the videos talked you through some of the very basic principles of the OSCE examination. And we're going to go on and now look at the part 2 of the video, but please pop your questions into the chat box as we go. So the next one is the communication skills test, okay?
With the training for the NMC OSCE, there's naturally an emphasis on observing best clinical practice in the role, as outlined in the Royal Marsden Manual and the European Resuscitation Council guidelines. However, applicants need to be aware that there's a strong focus placed on communication skills, in particular how they interact with the patient, build rapport, and involve the patient in decision making. Throughout your preparation, there will be a focus on developing these skills. In this video, we'll go through some hints and tips to provide clarity and reinforce your practice. Most importantly, continually explain your actions to the patient. This demonstrates that you're involving the patient in their care and also helps to make your reasoning and course of action clear.
Can I take a look at your allergy band?
Yeah, I think that's on there.
All right, so it says Mark Brown, 25th of 9, 1957. All right, so the name of the drug is not written, the drug that you're allergic to.
All right.
So I'll make sure that after I am done with my observations, I'll come back with a new allergy band, which
Okay.
indicates the name of the drug.
Okay.
Okay.
Involve the patient in any decision making and ensure that you have their consent before undertaking any actions.
So I'm here, Mark, to do a set of observations on you. So I'll be checking your temperature, blood pressure, respiratory rate, your heart rate, and your oxygen saturation levels in your blood.
Okay.
Is that okay?
Effective communication will help avoid any uncertainty. For example, by making it clear which pain scoring tool you're referring to.
So if you have to score it on a pain scale of 0 to 10, where 0 is the least and 10 is the worst pain, where would you score it?
4.
4. So
Yeah.
do you think you're okay now, or do you need any painkillers now?
I think I'll manage. I'm okay.
All right. Okay.
Explaining your actions will also help ensure you're treating the patient with dignity and respect.
All right, so I ensure that all the doors and windows are closed and adequate privacy is given to the patient. All right, Annie, so I'm just exposing that little bit of your thigh to just have a look at the injection site. Is that all right?
During conversation with the patient, make sure you both listen and respond to what they say. By doing so, you will build a more effective rapport.
So Julie, I'm going to ask you a couple of questions. What sort of job are you doing?
Yes, I'm a carer for an elderly gentleman.
Okay, so were you working until recently?
Up until the end of last week, yes, but I've had to take some sick leave.
Engage in active listening, react and respond to patients. Use both verbal and non-verbal communication. Make eye contact often. If a patient asks for something that is outside the scope of your role as a newly registered nurse, do not feel obliged to provide this. Always say that you will need to check with someone who will know and that you will come back to the patient.
So do you have any concerns, Jack?
Just when am I going to be discharged?
Okay, well, I do not know that, but definitely I'm going to speak to your doctor and he will come and guide you on that and he will be able to tell you better.
Above all, keep in mind your role is that of a nurse at point of registration. Remember, in your practice, you'll be performing at this level. All of these tips are relevant in your everyday practice as a newly registered nurse. However, there are also some tips about how to effectively communicate during the OSCE itself. Even when not addressing the patient directly, you should continue to talk out loud, explaining the key things you're doing. Try to give voice to your thought processes. In other words, speak your thought bubbles. This ensures the assessor understands what you're trying to do and your reason for doing it.
Now I can see that my trolley is clean. So I'm going to assemble all my articles on the bottom shelf. So first of all, the dressing pack. So the packet is intact and the expiry is valid till December 2019.
Talk through what you're doing as though you're teaching someone else to do it. Make statements with assertiveness and authority.
Before that, I'll be checking the capillary refill. So I place it at the heart level and squeeze it for 5 seconds. Release it, and I see that it has come back within 2 seconds, so that's good.
You need to demonstrate effective communication, whether you're dealing with an actor or a mannequin. In both cases, they represent a genuine patient. In the case of a mannequin, the assessor will respond to your questions as if they were the patient.
Hello, good morning.
Good morning.
My name is Stephen. I'm your nurse this morning. Can I know your full name, please?
John White.
Can I check your ID band?
Yes, please.
Yeah.
Don't be led by the appearance of the mannequin. Remember, they could represent a patient of a different gender or age, for example. One tip here is to confirm the age and gender of the patient out loud, which will help to reinforce the scenario details in your own mind.
Could you tell me your date of birth, please?
Yeah, it's the 30th of the 3rd, 1962.
All right, I see the date of birth is 30th of 3rd, 1962. It's 30th of 3rd, 1962.
You're allowed to ask for clarification about the parameters of the activity. For example, there are different styles of mannequin. A practical question about how a particular model of mannequin works would be acceptable. You cannot ask questions about how to perform your duties or ask for guidance on how to undertake them. Asking someone to repeat themselves is fine. For example, if you struggle to understand their accent.
Sorry, I didn't get what you said. Can you please repeat it for me?
If you realise you've made a mistake or forgotten something, make sure you say so before time runs out during that station.
I forgot to check if the patient has got any swallowing difficulties. So
Okay.
I'll be checking again before I administer. So Mark, do you have any swallowing difficulties?
No, I don't.
Okay.
It's common for candidates to get nervous before any examination. Focus on the task ahead and ignore any activity or background noise around you. Think about teaching someone else the key points and start rehearsing some of the questions. Remember, there is nothing new to you in these simulations. You are simply being asked to demonstrate what you already know.
Okay, that's great. So that's given you a first introduction to the communication station, okay? And as the presenter said on there, you all of you know the skills for this. A lot of this is about saying it out loud, which I know feels very alien, because in normal practice you would just go and deliver that care to the patient, but a lot of it in the OSCE is saying out loud everything that you're doing, everything you're thinking, so that the examiners can see the thought processes that are there. So Jack, if we could just go on to the next video, please. So we're going to look at the admission video, okay? Please pop your questions in the bar.
In this video, we'll take a brief look at the admission document you will be presented with at the start of the APIE stations. At the start of simulation, you'll have 5 minutes to review the patient admission document. This will help you to decide what the focus of your questions to the patient will be. During this scenario, you will need to complete either a National Early Warning Score NEWS or Glasgow Coma Scale GCS. Typical scenarios that you might encounter in the workplace where you need to use the National Early Warning Score might include: patient presents with breathlessness, patient presents with abdominal pain, pre and post operative surgery, both stable and unstable asthma. Typical scenarios where you would apply the Glasgow Coma Scale include head injury, stroke, subdural hematoma. Note that these lists are far from exhaustive, and wide range of other symptoms and conditions could be encountered. Quickly scan through to pick out the key points about the patient details, such as what they are presenting with. In the first instance, focus on the presenting condition of the patient. During your training in the workplace, you will practice how to prioritize clinical information quickly and efficiently to effectively assess the patient. The admission document can also provide guidance about starting a conversation with the patient in relation to their activities of daily living. In the next video, we'll look at how this information can be used effectively during a patient assessment.
Thank you, Jack. Okay, so if we could just go on to the next slide, please.
In this video, we'll look at assessment as part of the assessment, planning, implementation and evaluation model as used in everyday clinical practice. During the assessment station, you'll be asked to assess a patient, played by an actor. You could be faced with a wide variety of scenarios in clinical practice. This video will reinforce some of the key actions and behaviours that you should observe in all cases, regardless of the type of scenario you may encounter. Remember to treat the station as though you are in practice. Use the mindset that this is a genuine patient to be treated. At the start of any assessment, mentally check off the 6 C's that you will need to demonstrate in your practice: care, compassion, communication, commitment, courage, competence. Always ensure it's safe for you to approach any clinical environment.
I enter the room, I check for the scene safety. I see that the room is safe to approach.
Look for items such as trailing leads or foreign objects, which can create a trip hazard, and take steps to address these.
As I enter the area, I check for the scene safety. The scene is not safe for me to approach. I make the scene safe.
Be aware of any additional hazards that might compromise the patient's safety. Cigarettes and lighters, for example, should be moved.
So before I do my observation, I see there's a pack of cigarettes here. Do you smoke, Jack? You smoke? Yeah. Okay, I want to tell you that this hospital is a smoke-free zone and there are oxygen vents all over the place and you are using oxygen yourself. So is it okay if I take the packet of cigarette and move it around out from your site?
Check for medication left lying on tables. These should not be taken unless prescribed. Glasses or jugs of water should be moved away depending on the patient's clinical need. You must demonstrate hand hygiene using the correct ALIF hand washing technique. You can save time by doing this as you introduce yourself.
Hello.
Oh, hiya, nurse.
Hey.
Are you okay?
How are you?
Oh, just a bit drowsy.
I am Nurse Bincy and I'm the nurse who will be taking care of you today.
It's worth repeating that effective communication with the patient is vitally important from the start. Introduce yourself early and start to establish a rapport.
Hi, good morning. My name is Ansi. I'm your nurse for today. May I know your full name?
And my name's Julie Smith.
So Julie, what brought you here?
In clinical practice, it's always important that you check the patient's ID against their ID band and check the details of any allergies they may have.
Can I check your ID band? Okay. Okay, your name is John White and your date of birth is 1st of 1st, 1960. And your hospital number is 001 000 12345. So do you have any allergies? Ibuprofen. Okay, I see that you have an allergy band as well with the same hospital number. Okay.
The patient will not necessarily be wearing an allergy wristband, or the details may be incorrect. So always check with the patient and rectify any mistakes.
So Mark, can you tell me, do you have any allergies?
Oh, ibuprofen.
Okay, and what exactly happens when you take ibuprofen?
I get a rash and I get a bit of a wheeze on my chest.
All right, so I'll make sure that I don't give you this drug, okay? Can I take a look at your allergy band?
Yeah, I think that's on there.
All right, so it says Mark Brown, 25th of 9, 1957. All right, so the name of the drug is not written, the drug that you're allergic to.
All right.
So I'll make sure that after I am done with my observations, I'll come back with a new allergy band, which
Okay.
indicates the name of the drug.
When conducting your assessments, do not simply run through a list of questions, but bring the patient into a general conversation.
So Julie, what brought you here?
I've had a hernia on the right hand side for a couple of years,
Okay.
and I've come in to have that repaired.
So have you got any pain now?
No, not today. It's not so bad when I'm lying still.
Make sure you listen and respond to what they say. By doing so, you'll build a more effective rapport with the patient.
How are you feeling? Are you okay?
I just feel pressure when I'm breathing.
Feeling pressure? Okay, just try to relax. We'll just try to help you. What brought you to the hospital?
The last couple of days I've found it harder to breathe and I've been coughing a lot.
If asking them about any pain, make sure you're clear about the pain scoring tool you're using.
So Mark, can you tell me what exactly brought you to the hospital?
I fell. I was cleaning my windows in the house,
All right.
and I was just using some ladders, and I just slipped and fell off the ladders, and I banged the side of my head. It's
Oh, so
really sore, to be honest.
all right. So do you have pain now?
Yeah, it's quite painful. I've got quite a bad headache.
So if you have to score it on a pain scale of 0 to 10, where 0 is the least and 10 is the worst pain, where would you score it?
4.
4. So
Yeah.
do you think you're okay now, or do you need any painkillers now?
I think I'll manage. I'm okay.
All right. Okay.
Pay attention to the environment and, where possible, use any items that you see to help inform your assessment. For example, if you're emptying a sample bottle, you could use this as an opportunity to ask the patient about passing urine. Look out for glasses and hearing aids. Again, these provide an opportunity to discuss the patient's needs and requirements.
Oh, I see that you got some glasses here. Do you usually use that, or is that some reading glasses?
It's just mainly for reading. They're fine.
Okay, so are you all right without that now?
Yes.
Okay, fine.
If the patient is classed as nil by mouth, make sure they do not have food or fluids within their reach.
I've seen from the notes that you got a surgery today, so you got to be on nil by mouth, and you got a glass of water here. So do you mind if I take it away?
No, that's fine. Somebody just left it there, but I've not had any, and you're always fasting.
Thank you.
Patients may also be wearing nail varnish or jewellery, and appropriate advice should be given.
Oh, I see that you got some nail polish and some jewelry on. So can I tell you that before you're going for this surgery, you'll have to take your jewelry and remove that nail polish. Is that okay?
Yeah, that's fine. My husband's going to take it home, and then when he comes in a bit.
You should follow the normal routine as you would in practice when recording the patient's observations. The key difference is that you need to speak your thought bubbles and make your course of action clear. In the following examples, we'll show how this might work during the exam. Talk to the patient consistently through the scenario and keep them informed about what you're doing. Before starting, check that the patient is rested, that they do not need the toilet, and that their legs are uncrossed.
So before I start taking observations, have you been taking rest for the last 20 minutes?
Yes.
Have you emptied your bladder?
Yes.
Okay. And can you make sure that your legs are uncrossed?
Yeah.
Okay, thank you.
Once you've checked they're comfortable, ensure that the patient is happy for you to proceed.
So I just wanted to take a set of observations on you, which includes your blood pressure, your temperature, pulse, respiration, and your oxygen saturation. Is it okay for me to proceed?
Yeah.
Make sure you state aloud that the equipment is clean and calibrated.
I have calibrated the equipment to 0 and I've cleaned the equipment prior to use.
When taking their temperature, check that the patient is not wearing a hearing aid and check for signs of inflammation in or around the ear.
So Mark, I'll be checking your temperature now, and for which I need to pop this inside your ear. Okay, so do you have a hearing aid on?
No.
All right, I'll just check if there is any sign of redness or inflammation. I see that it's clear. Okay, I'll just put this in.
It's always good practice before taking blood pressure to check with the patient that they have no cannulas or if they've undergone any surgery in that arm.
So first I'm going to take your blood pressure, which is on your left arm. So have you had any surgeries or anything before in the past? No. So I see that there is no lymphedema, no inflammation, no signs of any infections. So it's safe for me to put the BP cuff around this arm.
When checking their respiratory rate, do not explain what you're doing until after you have taken a reading to avoid affecting the result.
So I've checked the respirations for complete 1 minute for the rhythm and effort of your breathing, and I found that it's 22. Okay, so I'm just going to document it. Is it okay?
Before taking saturation levels, check that the patient is not wearing nail varnish or false nails. Measure the capillary refill time and state the results.
So now I'm going to put the probe on your right finger. So before putting the probe, the hand is not cold, it's not clammy, and I check the capillary refill. And I see that the capillary refill is good. It's less than 2 seconds. So it's safe for me to put the probe on the arm and check your oxygen saturation. Okay.
For GCS observations, check that they're not wearing contact lenses and ask about eye surgery before measuring eye reaction.
So, Mark, can you tell me, do you have contact lens right now in your eyes?
Contact lenses, no.
No, okay. And did you ever have any surgery on your eye?
No.
No, all right. So I'll be flashing this light onto your eye just to see the reaction of the pupils.
Okay.
Is that okay? Okay.
As part of a GCS assessment, you will also need to assess limb movement and power.
Mark, did you ever have any surgeries on your back or on your neck or shoulder?
No.
No. So are you okay lifting your hand up?
Yeah.
Okay. Now, if I apply pressure over it and if I resist against gravity, will you be able to resist if I push this down?
I think so, yeah.
That's good. All right. Is that okay?
Yeah, that's fine.
All right. So can you raise your left leg for me? Okay. And if I apply a gentle pressure, will you be able to resist that?
Yeah.
Okay, that's fine. Now I'll be checking the similar way on the other leg. Can you raise this leg for me? Okay. I'll be applying gentle pressure. That's fine. All right. So let me cover your back.
After completing the clinical observations, state that the equipment will be cleaned and replaced.
So now, Julie, I've just finished my observations. I'm going to clean and replace the equipment and do my documentation. So I'll be back to you soon. Is that okay? Thank you.
Okay.
Explain to the patient that you're documenting the results in the observation chart and state any follow-up actions you need to take.
So I have done the documentation and the GCS score has come to 14. And so I'll be monitoring the patient every hourly since it is less than 15. I've also documented the new score, and the new score is 0.
It's important that you familiarise yourself with the scoring system for both NEWS and GCS. For example, any patient using oxygen must automatically be scored as at least a 2 on the NEWS chart. Make sure you escalate appropriately if the score is outside of normal parameters.
So I've documented the respiration, saturation, temperature, blood pressure, heart rate on the NEWS chart, and I have found a total score of 4, 2 for the respirations and 2 for your, since you're using the oxygen mask. So I see that the NEWS score is, it's quite high. So I'm going to monitor the observations of you, Jack, every half an hourly, as well as I'm going to consult with the doctor right now to see if any escalation of plan is required for you.
During ongoing conversation with the patient, it's essential that you continue to demonstrate effective communication skills.
So Julie, I'm going to ask you a couple of questions. What sort of job are you doing?
Yes, I'm a carer for an elderly gentleman.
Okay, so were you working until recently?
Up until the end of last week, yes, but I've had to take some sick leave.
Look for any opportunities to discuss health promotion. For example, if you notice a packet of cigarettes, you can use the opportunity to mention available services to help quit smoking.
So Mark, I see a pack of cigarettes here. Do you smoke?
Yeah, I do.
So can you tell me how many cigarettes do you smoke?
10 to 15 a day, really.
10 to 15 a day?
Yeah.
Okay, so have you ever thought of quitting to smoke?
Not yet, no. I might do after this, yeah.
Okay, because we've got a smoking cessation team here in the hospital, and I'm a bit concerned because the smoking might aggravate your condition. Yeah. So for now, I'll be keeping the cigarette pack aside. I'll be locking it and I'll be handing it to your relatives when they come. Is that okay?
Other areas for concern might arise during the assessment, for example, diet or exercise.
All right, really. So what about your diet pattern? What sort of diet do you take normally?
It's a bit erratic, to be honest, because I work really strange shifts and my husband works shifts as well. We tend to kind of just eat, ready meals and fast food. It's not a very good, not a very well balanced diet at all.
Okay, is that giving you a lot of bowel problems?
I am quite constipated, but I do tend to only go to the loo 2 or 3 times a week anyway.
I can see that your diet is not really healthy, and would you like me to refer you to a dietitian? A dietitian would probably give you more suggestions regarding your diet and could probably help with your constipation. Is that okay?
Well, I've tried Weight Watchers a few times, and that's not worked. So if anything else can help, I'm open to suggestions, particularly if it'll help me recover after the operation.
Where the patient has concerns or worries about their activities of daily living, explain what you will do to address these.
The problem is I've got stress incontinence and my toilet is downstairs. So at night, I know I struggle to get down the stairs, and I'm worried that after my operation, if I need to get up and down to the loo quite quickly in the night, if I'm drinking too much fluid during the day, I'm going to have more problems. That's what's worrying me, really.
All right, I can understand your problem. I can have a word with the physio and they can look into the rehabilitation plan, and if necessary, a commode can be arranged for you to use upstairs. Will that be okay?
During your assessments, it's really important that you pick up on any details about home life, like family, pets or children. The patient may act as a carer for a relative, for example.
I've got a son he's 20, but he has learning disabilities, and I care for him. And if I'm not around, I don't know who's gonna care for him.
So Jack, we have got social services in our hospital. So would you want me to refer you to them?
I already have a social worker. I've got the number in my.
So I'm going to take the number and I'm going to call the social service person who will go back home and take care of your children. So you need not worry, just relax and we'll just sort it out. Is that okay?
At the end of the assessment, make sure you mentally review what you've done. Remember to check the patient has everything they need in relation to the 4 Ps: position, possessions, personal care, pain.
Do you want me to position your pillow properly?
I need to sit up.
I'll do that for you.
Okay.
Can you just move forward? Good. Are you comfortable?
Yeah.
Remind the patient of your name and have a final check of their needs.
So Mark, I'm done with your observations. Okay. So I'll be here around.
Okay.
If you need anything, I'll just place the buzzer in your hand.
Thank
so
you.
You just need to press this and I'll be here. Is there anything that you want to ask me?
No, that's great. Thank you.
All right. I might come back again to ask some more questions. Is that okay?
Yeah, of course.
All right. And I'll also see if you're due for any painkillers and I'll come back with it.
As part of the assessment process, you will need to consider what risk assessments need to be completed for the patient's individual needs. You should verbalise key risks at the end of the assessment.
I'll make sure all the risk assessments, including the fall risk, will be done before she goes in for the surgery.
Remember, effective hand hygiene at the end of any interaction with patients is essential. In summary, effective assessment is not just about following the correct procedure, but demonstrating effective communication, having knowledge of risk assessment processes, and being able to develop follow-up plans and actions. Remember to confirm the patient's ID and check this against the documentation. Accurately complete all observations and documentation. Keep the patient informed throughout. Remember, for measuring the respiratory rate, you should only mention this after taking the reading. Identify any health risks that arise during the assessment and refer these appropriately. This includes smoking and alcohol consumption. There must be a clear match between the risk and the level of escalation. Consider any risks for the patient and ensure these are addressed. This concludes our overview of the patient assessment station. The information you've collected here will be used when planning patient care.
That's great. Thank you, Jack. So we've just had a couple of technical issues with one of our ladies trying to join the call. So I'm just going to share my screen now and hopefully this will work. Okay. Can you see my screen? Can I have a thumbs up if you can see my screen? Thank you very much. Great. Okay, so we've just done a very brief introduction to the OSCE training videos. Now, please be assured, I know this is one of the main concerns because that pressure is on when you arrive to do your OSCE training and pass your OSCE. This is just an introduction to it so that when you arrive, you feel a little bit more familiar. And as I spoke about last week, I will be giving the OSCE handbooks out to people that have had their certificates of sponsorship issued. And whichever employer you are going to, you will have a full and comprehensive OSCE training package delivered, which is normally over 2 to 3 weeks full time. So this is in addition, not instead of, okay? So please be assured. Not had any OSCE questions come up quite yet. So while lovely Jack is still trying to get Daya on the call, I'm just going to move on to Mark so you can see my screen. So hopefully in front of you, you can see the Devon flag. So in Devon, we are very proud of our area, our beautiful area within the UK, and this is a Devon flag. So you will probably see this quite a lot, okay? Jack, can you still see my screen? Yeah, thank you. So last week we spoke about the Devon cream tea. Now, I thought it was nice to introduce you to some of our English food. Now, one of the things we are famous for in the UK, which actually one of my colleagues reminded me of earlier this week, is roast beef. So there's a picture there of a roast beef dinner, and this is traditionally cooked on a Sunday. So very often on a Sunday in the UK, we will have a Sunday roast dinner. And you will see that advertised within restaurants and pubs that you visit when you're over in the UK. And that consists of a cut of meat, in this case it's beef, and roasted vegetables. So I thought, while we're just waiting for Daya to join the call, I thought we would, if I can get this to work. Oh. This is how we make an English Sunday dinner.
You can't see it, Carla. You're still showing the PowerPoint.
You can't see it. Can you see it now?
No, just your PowerPoint. You can see it, but there's no sound. Carly, I think the video's frozen on my end.
Can you hear me, Jack? Okay, so we've just had a brief introduction there to another one of our English food delicacies. So last week we had the famous Devon cream tea, and you've just seen a very brief introduction to our famous English Sunday roast dinners. So I'm just checking down through the chat. Unfortunately, Daya and Rima have had some technical issues this morning and haven't been able to join us, but we will try again next week. So are there any questions in the chat box that aren't related to certificate of sponsorship that I can help with? Let's have a look. Right, so Jack, it looks like you've done a great job in answering a lot of these questions. Just scrolling down through.
So there's two there, Carly, for you. So one of them, in case of any physical issues, can they have a 6 or 8 hour shift?
Okay, so in terms of physical issues, I'm assuming you mean sort of maybe existing health conditions and things like that. So within our NHS organisations, yes, we do always take into account anyone's previous sort of existing chronic conditions or illnesses that may affect your ability to work the longer shifts, and we will always do our best to accommodate them. So I would suggest that you have that conversation with your manager when you're introduced to them. But it's, yes, we would do our best to accommodate that. And I can't see the second question, Jack.
So the second question is, within how many months should we complete the OSCE?
Okay, so on average, within any of the providers, whichever hospital you're deployed to within Devon, you will start your OSCE training within the first couple of weeks. And the expectation is that you would sit your OSCE exam on average within 3 months of arrival. There's no definitive time frame for that, but obviously it's in your interest and our interest to get you through your OSCE examination quickly. Obviously, on top of that, you know, we need to make sure you feel fully supported in whichever clinical area you're working in. So you will have that full induction period, you know, whilst you're waiting for your PIN number once you've passed the OSCE, which can take a few weeks. You will be working as a supernumerary member of staff with a registered nurse, so you're getting to learn the role. So by the time you get your PIN number, you feel confident to be able to take a caseload. Okay,
Perfect.
so was that all there was for me? Was it a lot of COS questions?
There's another one that's just come in.
Yeah.
Is COVID vaccine necessary to come to the UK as a nurse?
So I would need to check the updated information on that, Jack. Did we have that question come up yesterday?
No, it actually come up earlier today. Our understanding is that no, you do not need to have your vaccine before you come to the UK. However, we would recommend, if you can get both doses before you leave your country and come to the UK, please do it. We don't want to put your health at risk. But if you can't have both doses, obviously we will be provided once you're in the UK, and that's something we can look at for you.
That's lovely. Thanks, Jack. So I guess part of my question to all of you attendees on the call now is, are these weekly webinars useful to you, and what else would you like to see? Because I'm very happy in taking feedback and, you know, changing the way that the things that we are delivering on this, because I want this to suit you, because these are put on for you, and to make sure that you feel more confident before you arrive to the UK and you're familiar with the expectations. So please pop in the group chat anything that you would like to see. So for next week's webinar, we're going to try and get Daya and Rima on the call to talk about nursing in the UK and how this is different to India. I've also asked them to talk about the schools process and how they found the process in integrating their children into our local UK cultures. But please, yeah, give me some feedback, and I hope that you've enjoyed the OSCE training videos. Obviously, we only got to assessment part of the AP, which is the big one in terms of your OSCE exam. And like I said, those people that have had their COSs issued, I will be in touch over the next few weeks, and we'll really start to step up that support for you. But I think one of my main tips today would be to ask you all to make yourself familiar with our Nursing and Midwifery Code of Conduct. So if you've not already looked at the Nursing and Midwifery website, which I'm sure you all have, that has a wealth of resources on there, including OSCE information. So please have a look. Make yourself familiar with the Code of Conduct, because as I've said before, that is the basis of all of our professional practice and behaviours within the UK as a registered nurse. And if you can be familiar with those expectations before you get to the UK, you will be one step ahead. So as Jack has said, we're going to be uploading all of these videos to YouTube, so you better catch up if you've missed any. Please tell your friends about our webinars. Anybody is welcome to join our Thursday webinars. They will always be every Thursday between 10 and 11. And thank you everybody for attending. I hope you've enjoyed this morning as much as me, and we will see you next Thursday. Bye.